So it is my honor to introduce our next speaker, which is Dr. Khan. Is it Khan? Dr. Khan, who will be doing a supportive and integrative medicine presentation today. And do you want the microphone? Because
my name is Niloufer. I'm an assistant professor of medicine in the lymphoma division at City of Hope. I moved here recently from New York, but the weather makes me feel like I'm at home. So thank you for inviting me to speak here today. So we'll talk a little bit. There's not a lot of specific data for integrative medicine in CTCL yet, but we'll start by talking a little bit about some of these different definitions. We'll discuss some of the general guidelines around the use of integrative medicine in cancer care, and we'll talk a little bit about what we do know about integrative oncology in patients with cutaneous lymphomas. So cutaneous lymphoma, as we all know, is generally a chronic disease. It's something that patients live with over time. And generally, when we think about treatments, we think about using multiple different treatments, and we individualize our treatments to the specific patient. So many patients will go through and cycle through drugs, and our goal is really using the mildest and safest therapy that we can for as long as we can. Trying to make this something that's tolerable over a long period of time. But we know that there's also a lot of quality of life burden that's associated with CTCL. I certainly don't need to mention here, but yesterday at the World Congress, I was moderating a patient panel, and really, I was struck by the patients kind of, generously presenting their stories and of their journeys, and the one thing that they really kept mentioning was itch and just how it really kind of takes over everything and is something that they can't get away from. And so there's itching. There can be, depending on what the lymphoma has presented as, there can be some pain, there can be cosmetic discomfort. And we've actually found that there can be more, sometimes more anxiety, more depression associated with this when compared to, other types of skin conditions. So when we're looking for, chronic therapies that are mild, that are safe, that are effective, integrative medicine makes sense as something that we can use to help with some of these symptoms. So there are a few different definitions. There's an NIH center that focuses on this, and so really these are considered healthcare approaches that are developed outside of mainstream Western or conventional medicine. So when we refer to alternative medicine, it's something that's used instead of or in place of conventional medicine. Complementary medicine is used together with conventional medicine. And then integrative medicine is something that's done, specifically in coordination with conventional medicine. So it's designed to really help, maximize the benefit of conventional medicine, add additional support. Some of you may be familiar with supportive care. So supportive care is a field of medicine that's specifically dedicated to symptom management. And so there are some similarities. It's, integrative medicine is also focused on symptom management, quality of life. It has a holistic philosophy taking into account the whole patient, their specific needs. But some of the differences are that, integrative medicine kind of goes a step further. It really thinks about the whole patient's lifestyle, thinks about the anti-cancer effects of natural products, and truly focuses on optimizing the well-being of the whole patient. So some of these categories, there are natural products, things like supplements, herbal products, teas, psychological interventions, so thinking about, using meditation, mindfulness, music therapy, things that are more physical, body-based, so chiropractors, massage, manipulation, combination mind-body, things like yoga, dance therapy, tai chi, And then, kind of other, whole medical systems, so things like traditional Chinese medicine or Reiki, that really, encompass a broad variety of things. The use of integrative medicine is growing. So this is a survey of services offered at NCI Comprehensive Cancer Centers, which are dedicated centers of excellence for cancer care. And so between 2009 to 2016, we can see that the percentages of centers that were offering these services is fortunately increasing. And so certainly if you're interested and are near one of these centers, I would encourage you to seek them out. And these are the results of a survey of practitioners at a comprehensive cancer center. So reporting some of the reasons why integrative medicine was involved and consulted. And so some of the main reasons, I think, around herbs, supplements. Oftentimes patients will ask if they can, safely use a supplement, and in addition to looking for pharmaceutical interactions, our integrative medicine colleagues can really guide us and help us figure out what supplements are safe and helpful. Things like diet, and then things like just incorporating a general approach into their care. So as a field, we're trying to study this formally now and get some data behind different approaches. So a few examples. We've studied specific supplements. So for example, ginger was studied as a supplement in a series of patients. And was found to reduce the severity of chemotherapy-induced nausea as rated by patients. And I think just to highlight that, integrative medicine ideally does work together with traditional oncology. There was a large study done of patients with colon cancer, looking at the use of multivitamins. There really did not seem to be any significant differences found in recurrence or survival or severe side effects, grade 3 or 4 side effects from the chemotherapy. But it did seem like there was some reduction in fatigue. So I think, again, it's something that should be included in your overall cancer care plan. There's also a lot of interest in looking at nutrition and physical activity. And so the American Cancer Society has issued some guidelines for cancer prevention. I think really these are things that many of us are probably familiar with, but they're guidelines that are really just based on maintaining proper health overall. So trying to maintain a healthy body weight, trying to engage in exercise, a healthy diet with fruits, with vegetables, etc. The ASCO group, which is the American Society for Clinical Oncology, has also started looking at this topic. So they have a few specific guidelines. They have a guideline for cancer-related pain. They've looked at acupuncture specifically in patients who have pain related to some treatments for breast cancer can often cause some pain, and so they've studied in that context. But also general cancer pain. They've looked at it in the treatment of neuropathy, which can occur with some of the treatments we have for cutaneous lymphoma as well, which is that numbness or tingling in the fingers and toes. They've also studied other ways to treat general cancer pain. So in addition to acupuncture, there's some data for massage, there's data for yoga, reflexology, guided imagery. They've looked at care using integrative medicine for treatment of anxiety as well. So both when patients are under active treatment, they've looked at mindfulness-based interventions, which is really trying to reframe the feeling of sensations and understand them in a non-judgmental way. They've looked at yoga, relaxation therapies, music therapy. They've looked at during procedures using things like hypnosis or using essential oils to help, kind of with the pain, the apprehension. And then after treatment, patients who are in survivorship or who have been in treatment for a long time, again, looking at mindfulness, yoga, acupuncture. So in patients with CTCL, I think it's also an area that we need to explore a little bit more. Christy, kind of mentioned the importance of surveys to us, and so this is just an example. The Cutaneous Lymphoma Foundation surveyed a group of patients asking about, their use of integrative medicine. So they, I think, received about 290 responses, and so. Many patients did report use of integrative medicine, about 59%, and about half of those patients, half of the patients surveyed said they used it to treat their CTCL, and half said that they used it to manage symptoms. The most commonly used methods were vitamins and minerals, prayer or meditation, diet, as well as exercise and yoga. As part of this survey, they also looked at the quality of life in patients. So one of the questionnaires that you may or may not have taken in the past is looking at skin-related symptoms from the lymphoma. It's called the Skindex-16. There's another questionnaire called the FACT-G, which looks at your general quality of life related to the lymphoma. And the way that we grade it, so the Skindex-16, the best scores are the ones that are lowest. So those mean the least impact on quality of life, feeling the best. For the FACT-G, it's the highest. So for both of these graphs, the best quality of life is on the right, and the worst quality of life, the best quality of life is on the left, and the worst is on the right. And so they kind of looked at which patients were using the integrative medicine, and it did seem like patients who had maybe more quality of life burden were experiencing more itch, more discomfort, were more likely to use some component of integrative medicine. They also looked at itch scores, and it seemed that the itch scores were higher in patients who were using integrative medicine. So itch, I think specifically in patients with CTCL, it's it's something that's quite predominant, and it's really hard to treat, as you may have experienced. There are a lot of different factors that go into itch, a lot of different pathways, and so there's different options that we have. We have topical treatments, we have systemic treatments, different types of medications. But oftentimes with these medications, they may have side effects of their own, and so, for example, with gabapentin, sometimes patients will say that they just feel really tired, or they may even say that it's just not effective, as effective as we want. There's also some data that itch and anxiety have some kind of interplay, that stress can worsen itch, that itch can worsen stress. So looking at patients who have other kind of itchy skin conditions, they've specifically said that when they're stressed, it makes their itch worse. And looking at a questionnaire of patients who had atopic dermatitis, it seemed that patients who had worse itch, scored higher, had more evidence of anxiety. And interestingly, the actual area and severity of skin involvement didn't really correlate with the anxiety. So, even patients the patients who had kind of the more widespread involvement weren't necessarily the ones who, had more anxiety. It really seemed to be the itch. And then, looking at psoriasis in comparison to something called vitiligo, which is a visible skin condition, but it's not very itchy. Patients still had worse anxiety with the itchier conditions. So one thing that we're looking at, hopefully soon at City of Hope, is trying to understand the role of mindfulness-based therapy and helping, with itch and anxiety. So we're planning a small study using Zoom and mindfulness-based training. So we'll sort of do a baseline assessment of how patients are doing, and then do weekly Zoom sessions with one of our chaplains who's trained in mindfulness training, help patients kind of practice at home, and then do some follow-up assessments to see if learning to approach itch in a non-judgmental way has helped, and if it's something that patients felt was effective and helpful. So just to kind of conclude, integrative medicine is really a spectrum of supportive care approaches to help optimize cancer care. There are many different modalities of integrative medicine, and so, of course, you have to find what works best for you. But they are, it is out there at different cancer centers, and so, City of Hope does have a cancer center, or a new center that's devoted to integrative medicine. And there are others, so if it's something of interest, I'm happy to talk about it now, but I also encourage you to discuss with your oncologist. So I just wanted to thank you all for your attention, and I particularly wanted to thank Dr. Richard Lee, who's the director of the Supportive Oncology and Integrative Center, Medicine Center at City of Hope. Yeah.
Are there any questions? Just a second, I got a microphone for you.
Sorry, do you have to be a patient at City of Hope to
participate in the integrative medicine that you talked about?
with the mindfulness training?
Yes.
Oh, we've sort of designed it to recruit patients who are at City of Hope, but I don't think you would necessarily need to be a patient at City of Hope. And I think if you, were interested in the other integrative medicine, approaches, I think you could also set up a consultation just for those at City of Hope. But yeah.
Hi, which campus is the facility on at City of Hope?
So the integrative medicine department is actually housed at Lennar, which is in Orange County. So there's some work being done at both, but the primary facility is in Orange County.